But first, can we agree on a term? I know you don't like the term addict or clean and stuff like that. So can we talk about that for a few minutes?
Yeah. So, and I know it's difficult for me to say that, because for people who are in recovery, there the language that you use, and James and I had a row about this a couple of weeks ago. But I suppose, you know, you're entitled to use whatever terms you're comfortable with. And I guess my concern is for people who don't understand the path that you've walked, using words like that gives a certain image of an individual. So if you say addict to somebody who maybe doesn't know somebody who's been in addiction, they mightn't understand the huge emotional pain that somebody has been on. So for me, the word addict does not bring in everything that you need to know. What has the person's story been? How hard was the journey that they walked on? So if you know, even if you think about your own stories, social exclusion and poverty and marginalization and poor access to education are all things that are bad for people's mental health. And sometimes when people have poor mental health, if they can't access the services that they need, they use substances to help alleviate the pain. And I just don't feel, for me, that the word addict gives the whole context. I think that it's a stereotyped word, and that's why I'm uncomfortable with it. Now, I know people in recovery use that word to describe themselves, and I do get a little twinge, as you know, when I hear the word. I feel uncomfortable with it. But it's your life story and your lived experience, and you're entitled to use that language. For me, that's not my journey. I wasn't in addiction. I'm not in recovery. So for me, I suppose it's an academic debate, and I'm interested in how you take away the stigma for the general public. And addict, for me, just holds a lot of stigma.
Yeah.
And I absolutely detest the word clean. I hate it, because the opposite of clean is
Dirty.
Yeah.
And I don't think anybody who is using drugs is dirty. I think they're vulnerable, and I think that they are in a lot of emotional pain. And I don't like that word. And I really, really don't like it when people use that word in services or in court settings, when they talk about somebody producing clean urine, or somebody has been clean for 12 months. It some way insinuates that before that and prior to that, that they were dirty. And I've watched all of your podcasts up to date. You've been really honest about the vulnerabilities that you had and the situations that you were in that contributed to the decisions that you've made. And when you were using, for me, you would not have been dirty. You would have been people who would have been in pain and who were reaching out for help. So that's, you know, that's the issue I have. And one of the things is that I personally feel that addiction is a mental health issue. I don't think it's a criminal justice issue. And if you think about depression and anxiety, 20 years ago in Ireland, they had a lot of stigma and people didn't talk about their mental health issues. And we've moved forward now, and we're always saying to people it's important to talk about your mental health. But for me, there's still a lot of stigma associated with addiction. And if addiction is to be considered a health issue, then it means there shouldn't be any stigma. So, you know, if I go to a hospital tomorrow and I say I'm really depressed and I'm really struggling, and somebody else comes in and they say, you know, I'm using opiates or I'm taking tablets or whatever it is and I'm really struggling. For me, both of us are presenting with mental health issues, and we deserve the same treatment and the same care. And it concerns me that the language that we use around addiction generates stigma.
Yeah, I think you make good point there around addict giving no kind of room for context. Like in recovery, or in the rooms, in recovery rooms, they say, I always understood addiction as to be the act of using the drug. But the problem is way deeper. Like the addiction, as I understood it, the addiction manifests itself in drug use. But the problem is not drug use. Like since I came into recovery, I've been around loads of drugs. Worked in homeless services, worked with addicts. There we go again. But now working with drug users, and I've been in the presence of people who are using. I never wanted to use the drug. Why? Because I was after addressing the underlying issue. That tells me the problem was never the drug in the first place. It wasn't. And I think maybe something like somebody who uses drugs, like in an eating disorder, you know, this person has an eating disorder, don't call them food addicts, you know. I think we have to leave some room for context. So, but I think then as well for people in recovery that go to NNA, because this is the free stuff that's available, a recovering addict is kind of like an identity that they wear, and it kind of builds camaraderie and kind of is good for social groups and, you know, finding new pairs. This is, I'm not a junkie or I'm not a scumbag. These are the labels. And I suppose we become used to carrying labels, and addict is another one. And, you know, and I'm always open to change and I'm always open to learn a new way. So when you spoke to me like that, I began to think critically of how I was actually describing myself. What do you think, Tim?
Yeah, that word junkie is like the way you hate addict. You know, I have family members that are heroin addicts, you know, and I've often been in the company of people and they'd speak about somebody that's in heroin addiction or something else in that nature, and they'd call them a junkie, you know. And for me, that word really, really hits here, because I understand what it's like to be somebody addicted to drugs, alcohol, gambling, you know. And I know why I was addicted to these things, you know. And I know as well why these people are addicted to they're blocking out all that pain, you know, the emotional pain. And that's probably stemmed from childhood or whenever. And it's a very, very, very hard thing for me to really get my head around at times. Sometimes I've just walked away from certain people's company that have used that kind of language, you know. And so I understand.
And that makes me really sad when I hear people using a word like junkie.
Yeah.
Because what you're saying is that you're a bad person.
Mm-hmm.
And as somebody who has worked in addiction services, and my research now is in the area, I have met very few bad people. I have met lots of people who were very sad and who were very hurt, but I have met very, very few bad people.